You need to hear this if you're a nursing student. Hey future nurses. I know the thought of pharmacology calculations might seem scary, but trust me, it's not as tough as it seems. Pharmacology calculations are essential for ensuring patient safety and effective treatment. With a little practice, anyone can master these calculations. We'll break down each concept into bite-sized pieces covering everything from dosage calculations to IV flow rates. You'll learn how to convert units, calculate dosages based on weight, and much more. So, take a deep breath, grab your calculators, and let's dive into the world of pharmacology calculations. This way, you'll gain confidence and proficiency in no time. Let's start with equivalents. Equivalents are crucial for understanding how different units of measurement relate to each other. For example, knowing that 1 gram equals 1,000 milligrams helps in accurate medication administration. Next, we'll cover dosage calculations. Imagine you're baking a cake. You need to convert cups to milliliters or teaspoons to tablespoons, right? Dosage calculations in pharmacology are similar. They help us determine the correct amount of medication to administer. For example, we might need to calculate the dosage in milligrams per kilogram of body weight. The key is to remember the basic formulas. Once you know these, you can easily calculate dosages. Just like you use a recipe to bake a cake, we use formulas and conversion factors to ensure patients receive the correct dosage. Remember, accuracy is crucial in healthcare, so practice these calculations until they become second nature. If we need to calculate a dosage of 2 milligrams per kilogram for a 70 kilogram patient, we multiply 2 by 70, so the dosage is 140 milligrams. Next, let's calculate a dosage of 5 milliliters per kilogram for a 50 kilogram patient. We multiply 5 by 50. Therefore, the dosage is 250 milliliters. Finally, let's calculate a dosage of 10 milligrams per kilogram for a 30 kilogram patient. We multiply 10 by 30, so the dosage is 300 milligrams. Great job. Now try the following questions to get more acquainted with the topic. On the next page, you'll find the heading Answers and the outlined question numbers with their answers. Next up, metric conversions. This is where things get a little easier. The metric system is based on multiples of 10, which makes conversions a breeze. Think of it like moving the decimal point to the left or right. To convert from a larger unit to a smaller unit, we move the decimal point to the right. For example, to convert 1 meter to centimeters, we move the decimal 2 places to the right, giving us 100 centimeters. So the solution is 1 meter equal sign 100 centimeters, 1 m equal sign 100 centimeters. Conversely, to convert from a smaller unit to a larger unit, we move the decimal point to the left. For instance, to convert 1,000 milligrams to grams, we move the decimal 3 places to the left, resulting in 1 gram. So the solution is 1,000 milligrams equal sign 1 gram. 1,000 milligrams equal sign 1 g. See? It's all about moving that decimal point. With a little practice, you'll be converting like a pro in no time. Try the following questions to get more acquainted with the topic. On the next page, you'll find the answers. Section 4. Let's dive deeper into pharmacology with some answers. First, here's the problem. If a child weighs 20 kilograms and the dosage is 8 milligrams per kilogram, what is the total dosage? Take a moment to calculate. Now, let's see the demonstration. We multiply 8 milligrams by 20 kilograms to get a dosage of 160 milligrams. And finally, here's the answer. The answer is 160 milligrams. Let's break it down. 8 milligrams per kilogram times 20 kilograms equal sign 160 milligrams. Now let's try another practice problem. If an adult patient weighs 60 kilograms and the dosage is 4 milligrams per kilogram, what is the total dosage? Take a moment to calculate. Now let's see the demonstration. We multiply 4 milligrams by 60 kilograms to get a dosage of 240 milligrams. And finally, here's the answer. The answer is 240 milligrams. Let's break it down. 4 milligrams per kilogram times 60 kilograms equal sign 240 milligrams. Try the following questions to get more acquainted with the topic. On the next page, have the heading as answers and outline the question number and answers. Section 3. Now let's dive into IV rate calculations. These calculations are essential for ensuring patients receive the correct dosage of medication over a specific time period. Don't worry, we'll break it down into simple steps. First, we need to know the total volume of the medication to be infused, the infusion time, and the drop factor of the IV tubing. The drop factor tells us how many drops are in 1 milliliter of fluid. Once we have this information, we can use a straightforward formula to calculate the IV drip rate. The formula is IV drip rate = total volume times drop factor, time. Let's say a patient needs to receive 1000 ml of saline solution over 8 hours, and the IV tubing has a drop factor of 20 drops per milliliter. First, we need to convert the infusion time to minutes. 8 hours times 60 minutes hour = 480 minutes. Then, we plug the values into the formula IV drip rate = 1000 ml times 20 drops ml, 480 minutes = 41.67 drops a minute. We round this to the nearest whole number, so the IV drip rate is 42 drops per minute. It's like setting a timer for medication delivery, ensuring a consistent flow. Now let's explore some advanced pharmacology calculations. For example, calculating the dosage of a medication based on a patient's weight. Suppose a medication's dosage is prescribed as 5 milligrams per kilogram of body weight. If a patient weighs 70 kilograms, the total dosage would be 5 milligrams per kilogram times 70 kilograms = 350 milligrams. Next, let's consider a practice problem involving a continuous infusion. A patient needs to receive 500 milligrams of a medication over 24 hours. If the medication is available in a concentration of 50 mg/ml, how many milliliters per hour should be administered? First, calculate the total volume needed. 500 milligrams, 50 mg/ml = 10 ml. Then, divide the total volume by the infusion time, 10 ml, 24 hours, 0.42 ml hour. These advanced calculations ensure precise medication administration, enhancing patient safety. Practice these problems regularly to build your confidence and proficiency. Remember, accuracy in pharmacology calculations is critical for effective patient care. Keep practicing, and you'll master these essential skills in no time. Let's review the solutions to the practice problems. For the IV drip rate problem, we calculated the rate to be 42 drops per minute. For the weight-based dosage problem, the total dosage was 350 milligrams. And for the continuous infusion problem, the rate was approximately 0.42 ml per hour. By practicing these calculations, you'll ensure accurate and safe medication administration. Try the following questions to get more acquainted with the topic. On the next page, you'll find the heading Answers and the solutions outlined by question number.